Typically, a child's cardiac arrest is often due to a breathing-related issue. Hence, the integration of breaths with compressions holds significant importance for children. When addressing a child during a CPR emergency, adhere to the same procedures for compressions, airway, and breathing as outlined for adults. However, here are the specific guidelines for child CPR. Witnessing a collapse. For witnessed collapse incidents, proceed with the steps intended for adults and adolescents in CPR. Unwitnessed collapse. In cases of unwitnessed collapse, perform CPR for 2 minutes initially. Then, temporarily leave the victim to activate the emergency response system and acquire the AED. Return promptly to the child or infant and resume CPR, utilizing the AED as soon as it becomes accessible. Child CPR involves specific techniques tailored for infants and children. Here is a guide on how to administer CPR to a child. Assess the situation. Check the surroundings for safety. Tap the child and shout loudly to assess responsiveness. Activate emergency response. If the child is unresponsive, immediately call 911 or your local emergency number. Open the airway breathing. Place the child on their back on a firm surface. Tilt the head back slightly to open the airway. Look, listen, and feel for signs of breathing for no more than 10 seconds. If the child is not breathing or only gasping, begin CPR. Chest compressions. Use compression to breath ratio 30:2. For a child 1 to 8 years old, use 1 or 2 hands for chest compressions. Allow the chest to fully recoil between compressions. Position the heel of one hand at the chest center, placed between the nipples. Using the second hand might not be necessary unless required to ensure proper compression. Similar to adult CPR, administer forceful and rapid compressions of approximately 2 inches deep, maintaining a rate of at least 100 to 120 compressions per minute. The methods for managing the airway and providing breaths are identical to those used for adults. Rescue breaths. Provide 2 rescue breaths after 30 compressions. Use the mouth-to-mouth or mouth-to-nose technique for 2 breaths. Each breath should last about 1 second and make the chest rise. Continue CPR. Continue the cycle of 30 compressions and 2 rescue breaths. Continue until the child starts breathing on their own, emergency medical personnel arrive, or you are too exhausted to continue. Use an AED if available. If an automated external defibrillator, AED, is available, follow the device's prompts for use.